Every year, 14 million Americans suffer from depression. Of these victims, 45,000 will commit suicide. Suicide is the 10th leading cause of death in the United States, right next to diabetes, kidney disease, and pneumonia. But this condition stands apart from all these other diseases, and it infects its victim like no other. And 2/3 of all depression victims will go untreated, leaving us to ask, why is depression so different from other diagnosable diseases? To start our journey for answers, we sought out professional knowledge. Mr. Diegler, can you just give us like a professional description of what clinical depression is?
Clinical depression is a set of symptoms where an individual is experiencing profound sadness, lethargy, and it's kind of interfering with their day-to-day functioning. They sort of feel like they're carrying an anchor around with them all day long, where everything is 10 times harder than it needs to be. So they can be having crying spells, they can be having issues with self-esteem, they can be having suicidal thoughts, homicidal thoughts. And some people, in the higher levels, they'll be acting on those.
So I think you kind of hit on some of that there, but what are some of the commonalities you've seen in your patients who are dealing with depression?
The common themes, most people are able to function, they're able to go to school, but it's a fight. I mean, most people that are coming in, we're catching it reasonably early in the process. But themes like things that are triggering the depression would be family stress, academic stress, social stressors, interacting with other kids and things like that. But usually it's family, school, and social stressors are the common themes that you'll see that people are talking to me about.
Typically speaking, with adolescents, do you think many of them, they're hesitant or afraid to seek out psychiatric help or professional help when it comes to depression?
With early adolescents, so we're talking kids in middle school, the vast majority of them aren't really they're not really seeking out help. Their parents are bringing them. As we start to move into high school, we start to see more and more kids asking for help, but I would say 60 to 70% of kids, it's the parents that are driving the therapy process. That's kind of age appropriate. I think a lot of adolescents are, they have that thing is, I got this, I can deal with this, and they're also going to seek out their social supports. I mean, that's who they trust other kids more than they do the adults, so they probably avoid it more than the adult population would.
A recent study has shown that teens are the most at-risk group for experiencing depression. 20% of all teens experiencing depression before adulthood. This statistic is up 13% from 1974, making this issue more and more prevalent today. And this issue is no far-fetched phenomenon. It occurs in our community every day.
How was waking up every morning with dealing with depression?
It made it really hard. I was just exhausted all the time, and I just never wanted to get out of bed even though I had things to do.
Was talking to people more difficult than it was before, or if you're better?
While I was really suffering, it was kind of hard to have genuine conversation with people. It made it difficult to actually say what I was feeling. I just kind of said what people wanted to hear.
Did you find it difficult did you ever want to talk to someone, or did you find it difficult opening up to people about what was going on in your life or asking for help as a teenager dealing with depression?
Yeah, it was definitely hard to ask for help or open up to people, or really just say completely the honest truth about what was going on in my head.
To further our knowledge about this condition, we paid a visit to a former member of our school who dealt with this condition, overcame it, and then chose to dedicate his life to helping those who deal with depression.
I have a great family. I went all state in sports, pretty generally liked. I have nothing really to be sad about. And the first thought of the day, every day, was how I'm going to commit suicide. And that's even before I even had a thought. The way I coped with it was just playing music and played guitar, and I don't know, it just made sense to me because no matter how bad I was doing, I could just go and play music and express how I felt. You know, I had 1 month this past September. I figured out I'm actually genetically, there's a reason why I'm sad is because of my genetics. I can't break down a thing called folic acid, which is crucial for neurotransmitters like dopamine, norepinephrine, serotonin, and my body doesn't create enough of this because they can't recognize the enzyme. So I wake up and I'm sad just for the hell of it. It's like seeing like a glass half empty. Like, it's just how it is. And you know, playing it for other people would be like, I wear glasses. If I were to go around and interact with people without my glasses, like I can't see anything. Like I have very bad vision. And why I say this is because this is how I feel like emotionally. Like I know things are there. I know what I should feel, but I can't process it.
A common misconception much of society has about depression is that it only affects those who are the loners or outcasts, when in fact in many cases this is just the opposite. That's what makes depression a very difficult condition to see, as it often affects those who you would expect to be affected the least.
How long have you dealt with depression?
I think it started like noticeably around 8th grade, 7th or 8th grade, so since middle school.
Coming from someone who has experienced it and like kind of knows the signs of it, you know how hard it is to like spot someone that is. Like kind of just elaborate on how that makes it unique and the fact that like you can't see who it is and like you don't know who you could expect it would be. Like as Murphy said, like you know they've got a very nice family, very wealthy, they do well. Like there's nothing he's got to be depressed about. So explain like kind of how depression is tricky in that way.
Well, I think it's really hard to necessarily see in some people because people will kind of go out of their way to either overcompensate for it or kind of intentionally hide it by showing like a happy side of them, but then it's like they go home and it's a completely different like switch that is kind of flipped on from like social life to when they're like alone. And yeah, I think it's just difficult in that aspect because no one necessarily wants to be seen struggling with depression, so people will kind of mask it as much as they can.
So in your instance, like when you talk about masking, like from your experience, like how did you mask it, and then like how did that like translate or kind of be different to your like private personal life?
Well, I mean, I don't know. I kind of consider myself like the funny kid or whatever. Like I can never really be serious in any regard at any point. But then, especially when it was worse around like freshman, sophomore year, it was I'd go home and some nights I'd be up all night just like crying, and some nights I just wouldn't sleep at all, and just up with thoughts of suicide, stuff like that. So it was kind of, yeah, I was just like putting on a face a lot of the time.
For those who are close to the victims of depression, the signs are subtle, but there are a few intrinsic signs you may be able to pick up on. What we're asking you is, so when these people come to you, are these people that you would expect, like, do you see anything wrong with them? Like, did you notice anything different about them? Or was it just kind of like a shock to you that, like, someone like that who, like, you know personally could be dealing with that?
My two closest people that came to me were my best friend and my sister. And my sister, she was always, I grew up with her, obviously, and so she was always a happy kid, and she always like was making jokes, doing things, like she was just the happiest kid. And then over like the middle school years, she started losing a bunch of weight. She wasn't going out, she wasn't talking to anyone. She was super sad, wouldn't leave her room. And we started to notice these things, obviously. Like she ended up losing around 60 pounds because she was just so stressed out about things and was depressed. And then later we see her gain a bunch of weight, and then she ended up losing it all again. So I noticed that, obviously. And my mom was more involved with helping her get the help, even though she didn't want it. And she wasn't as open with me or my family or friends, where she was more open with the therapist because it was someone who is outside of everything going on in her life. Whereas my best friend, she came to me more about it, and she didn't like talking about it a lot, but I was the main person, and it was hard for her. And I ended up helping her get help from a therapist, and she didn't like the therapist, but talking to me actually helped her get better, and she's doing better now as well. So I think talking about it has helped people in general.
So before your best friend approached you, did you notice anything different about her? Were there any signs that something may have been going on?
Like, not really. A lot of times I couldn't tell, but then there were certain things as, like, when we were, like, hanging out one-on-one, I noticed, or, like, when she stopped going out as much and hanging out in groups or not wanting to do anything at all. I noticed that right away, but then she'd be at school trying to smile and make other people happy. So it's hard to notice it at first, but since I was so close to her, I ended up noticing it. But a lot of times it's really hard to tell, and I didn't know for a few months that she was feeling that way.
Hearing from a professional and then those who have been affected by this condition, we see how depression can affect anyone at any time, and how important it is to have a strong support system due to this condition's unique nature. The best thing you can do as a friend or family member of someone you suspect may be suffering from depression is to maintain a supporting role in their life and encourage them to seek help. No one should have to deal with this disease alone.